Hi there. So I have new orders put in here for Jenny O'Malley, 0602XXX. She has an order for an in and out cath if she's retaining over 500 mLs of urine. They just bladder scanned her and she has 550 in her bladder. So we're gonna go introduce ourselves and perform an in and out cath. So I'm gonna gather my supplies here. I'm going to knock on the door. Hi there. My name's Caleb. I'm gonna be your nurse today. I just saw some new orders that the provider put in. I'm gonna go ahead and verify your name and date of birth. Jenny O'Malley, 0602XXX. MRN number matches. Awesome, the patient was able to verbalize her name and date of birth. I'm gonna ask you a couple more questions. Do you know where you are right now? She says College of Nursing. And do you know today's date? She says it's the 24th of August. So everything checks out there. Awesome. I'm also gonna ask, do you have any allergies to betadine or coconut or latex or anything like that? She says she has no allergies, so that's awesome. The provider put in some orders for you to get an in and out cath. So they bladder scanned you earlier and it seems that you have over 500 mLs of urine in your bladder. So we're gonna do an in and out cath to try and relieve some of that pressure and give you a little relief. Is that okay? She consents, she says that's fine. I'm gonna go ahead and wash my hands. We're just gonna do a little pericare before we begin. Got some soap and water here in my basin. Here, I'm gonna go ahead and just clean you off a little bit, honey. Wipe. Okay, I'm just gonna pat you dry. Okay, gonna set this to the side. Okay, I'm gonna get my other supplies ready here. You just stay positioned as you are. Wash my hands after pericare. I verified the orders. And I brought in my supplies. And my in and out cath kit is unopened, intact, unexpired, sterile. Excuse me. So we're gonna go ahead and begin with the procedure. The skill. I'm gonna move my tray over here. Keep everything view. Okay. Pie. Lunch border. Swing around. Let me just pull it a little closer. Okay. And wash my hands again. Leave that there. Did I turn my back? Should I start over?
I don't think you turned your back.
Okay, good. I'm just
Oh,
gonna
I said that in the video. Is that okay?
I think so. It's gonna be Professor Hubbard watching.
Okay.
So please forgive me, Professor Hubbard, or Professor Cowley. So I grabbed my sterile gloves. I'm watching here, keeping all my eyes on the sterile field. I'm gonna open it up like a book. Begin. stomach. Okay, so kind of sterile gloves on. We're gonna go ahead and just reach in here, bring my box a little closer, and we're going to set those down. Those hands here, get it a little lubricated, and we'll just leave it in there. Okay, I'm gonna reach around. We're gonna go ahead and just clean you off a little bit. Right here. Wipe down on the side. Over. This side. Over. And then down the middle. And I'm gonna bring my box closer, keep her open. Advance until we see urine. Have her drain. Drain, 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 drain. Okay, all finished. Put my supplies to the side. Take the gloves off. And wash my hands. And then we would let the patient clean her off a little bit and let her reposition. Okay, gonna take all my supplies out of the room. And let me know if you need anything and we'll be back to check on you, okay?